Today's speech by Mr. Obama, one of the first in days not to focus on health care. Let's get a check of where we stand on the issue on this Monday. The president is signaling he might drop a government-run insurance plan from his health care reform proposal. Republican lawmakers and the insurance industry strongly oppose the so-called public option because they say it'll be impossible for private companies to compete. Democrats say it's needed to keep prices down, but administration officials now say they can achieve that goal without the public plan.
And I think what's important is choice and competition, and I'm convinced at the end of the day the plan will have both of those, but that is not the essential element.
One alternative to the public plan would be nonprofit cooperatives or networks of health insurance plans owned by their customers. That idea could win bipartisan support in the U.S. Senate. Joining me now to discuss the latest on health care reform, Dr. James Rohack. He is president of the AMA, the American Medical Association. Dr. Rohack, welcome back to Bloomberg News. Good to see you again.
It's great to be here.
Sir, you just heard from Health and Human Services Secretary Kathleen Sebelius. She said while the administration does hope for a public option, it's not an essential element. What is your reaction to that?
Well, it's very important not to forget the goal, which is affordable, quality health insurance coverage for every American that preserves their choice of plan as well as their choice of the physician. You know, the final bill hasn't been written, and whether it has a public option or not, or if it has a co-op or not, we don't want to lose sight that there's some very important innovations and change in the private insurance market that really needs to be done. Getting rid of the pre-existing condition exclusion, making sure that when you lose your job, you don't lose your health insurance. So we believe it's very important in this continued discussion that we strengthen the private market, make sure that it's competitive, but also recognize that there is a safety net of a public option or a public system like Medicare and Medicaid that currently exist and needs to be strengthened itself.
Well, the former chairman of the Democratic National Committee, Howard Dean, telling NBC that the public option has to stay in and that he was disappointed that the administration seems to have strayed away from that. If there is no public option, will there be a giant hole in that so-called safety net you just spoke of?
Well, the private industry has shown that it can innovate and it can create products that are affordable, but the key is get everybody in the pool. And that's why it's important as we take a look at this evolution over the next month or two. Let's not lose sight of the important thing is every American needs to have affordable, portable health insurance. That can be done through the private sector in a way that, again, makes sure that the premiums are going for health care and making sure that we get rid of the unnecessary cost in the health care system that drives up premiums for everybody.
Well, then, are those co-ops a viable alternative then?
Well, co-ops, again, is a mechanism of pooling money where all the individuals, they're putting their own premiums, and they're the ones that are making their decisions over what do they want to have coverage for and what do they don't want to have coverage for. So it's a model to be able to look at. Is it viable long term? It certainly will need to have some capitalization up front, and maybe that's the role of the federal government to give the seed money to get this up and going long term.
Dr. Rohack, as you are no doubt aware, this debate has been contentious. We've seen the video from the town hall meetings across the country. A lot of angry American citizens talking about socialized care, some not believing the president when he says that we can make some cuts in the system and still be able to afford it without raising taxes on the middle class. I understand as a physician that the political sphere in terms of that is not something where you negotiate. But what do you think when you hear terms as death panels and socialized medicines? What's your reaction to that?
Well, when we take a look at what's the bottom line, it's clear there's a lot of misinformation out there. And the misinformation, unfortunately, in today's instant communication of the internet, can spread things very rapidly. What we need to do is take a deep breath, say, okay, what's the goal? Well, in America, we want to make sure that you've got affordable quality health insurance so you can get the care that you need before you get ill and not have to use the emergency room as the access point for all health care, because what happens Right now, all of that's spread to everybody else. Everybody's paying a higher premium.
Dr. James Rohack, the president of the American Medical Association, joining us from our Washington bureau. Dr. Rohack, thank you very much.